How to interpret SAPS scores. Have you ever wondered how mental health professionals assess the severity of schizophrenia symptoms? The scale for the assessment of positive symptoms, often referred to as SAPS, is a key tool in this process. Understanding how to interpret SAPS scores can provide valuable information about an individual's experience with schizophrenia. First, let's break down the structure of the SAPS. This scale is divided into four main areas: hallucinations, delusions, bizarre behavior, and positive formal thought disorder. Each area focuses on specific symptoms that may be present in someone with schizophrenia. Next, let's look at the scoring system. Each symptom is rated on a scale from 0 to 5. A score of 0 means the symptom is absent, while a score of 5 indicates that the symptom is severe. This scoring helps clinicians identify which symptoms are most prominent and how severe they are. When interpreting the scores, it's important to consider the domain scores. Each symptom within a domain is scored individually. This means that a clinician can see which symptoms are affecting the individual the most. Now, what about the total score? While the SAPS is often described as a 34-item scale, the total score is not usually used as a single measure. Instead, the scores for each domain are analyzed separately. This allows for a clearer understanding of the different types of positive symptoms present. Clinicians use SAPS scores to monitor symptom severity over time. This helps them assess how effective treatment is and make necessary adjustments. For example, if a patient shows a decrease in their hallucination score, it may indicate that the treatment is working. SAPS scores can also be used to assess remission in schizophrenia. Short forms of the SAPS provide a quick way to measure symptom severity, which can be particularly useful in clinical settings. However, it is essential to interpret these scores in the context of the individual's overall clinical picture. This includes considering other symptoms and life circumstances that may affect their mental health. While the SAPS is a helpful tool, it is part of a broader assessment process. Other scales, like the scale for the assessment of negative symptoms, are also used to get a complete view of the individual's symptoms. In summary, interpreting SAPS scores involves understanding the structure of the scale, the scoring system, and the context in which the scores are presented. This information is vital for clinicians to provide effective care and support for individuals experiencing schizophrenia.